right, good afternoon. We're going to go on ahead and get started as it's 3:03. I'd like to thank everyone for joining us on our office hours for today, August 13th. As we discuss school operations and reopening, I'm going to turn it over to Assistant Superintendent Ken Bradford to introduce our guest for today and walk us through what we will be discussing.
Yes, thank you, Meredith, for that introduction. And yes, today we're very excited to have all of you on here. Every week, our numbers keep growing on this call, where we're having 200 to 300 individuals participate. This week, we are very excited that we have a couple of special guests that have joined us. We have Dr. LaRon Finger from Children's Hospital New Orleans, who is on, and we also have our state fire marshal, Mr. Butch Browning, who has joined us today. So, without further ado, what I'll do is I'll let Dr. Finger give a few opening remarks. So, Dr. Finger, the floor is yours.
Thanks, Ken. Good to see you again, and thank you all for welcoming me back. I just want to start off by really thanking everyone on this call. Some of you have heard me talk before, not just professionally, but personally as the father of 3 girls in the public school system. I really appreciate all the hard work that everyone has been doing over the last several weeks to months to see how we can return our children and our educators to school in a safe and productive and efficient fashion. So thank you very much. Just to give everyone sort of a snapshot of Louisiana, where we are with COVID-19, we have just over 135,000 cases documented positive, and somewhere between 8 and 9% of those cases have been in children under the age of 18 years. Statewide, our percent positivity rate, which means out of all the tests done, what percent are positive, peaked back about almost exactly a month ago on July 9th. And this is after that initial peak we had very early on. And since then has been so slowly declining. We have regions of the state that have declined more rapidly. The area around New Orleans has a lower positivity rate than areas in other parts of the state, but all regions of the state are slowly declining in their percent positivity rate. That doesn't mean to say we aren't still facing areas of hotspots across, we're a large geographic state, but overall, the trends so far are certainly different than they were, again, 4 to 6 weeks ago, when we're seeing upticks, especially in areas of Acadiana, Baton Rouge, and northern Louisiana. With that in mind, I know we've got folks on from several areas of the state who are probably in different phases of virtual versus in-person learning. I know we're going to have a lot of time for question and answer. I'd be specifically interested to see if people can share what's worked and what has been a challenge as you move closer to operationalizing some of the things that we've been thinking about conceptually for several months. I'm thrilled that the state fire marshal can join us, because someone who's more expert than me can opine on what safe barriers are and what aren't, because I can do that from a COVID-19 perspective. But every time I do, I say, but you need to check with your state local fire officials to make sure it's safe to have in that space. So I'm thrilled to have someone else with that skill set who can answer some of those questions. I'd like to cover in the question and answer period a little bit about what appropriate face masks are and aren't. I never thought I'd learn so many different terms for things that could go over kids' noses and mouths, but there's a lot of them. And otherwise, I look forward to hopefully having a productive chat session where we can answer a wide range of questions. Thanks, Ken.
Thank you, Dr. Finger, for that. Meredith, let's go to the next. Let's go to the next slide. And what I want to do is at this time just briefly go through the agenda for today, and then we're going to transition into our state fire marshal guest today, Mr. Butch Browning. So just an update of what we're going to talk about today. We're going to talk about partitions that are in place. We've had several questions come in, so what I'll do is when we get to those slides, Mr. Browning will have a few words in the State Fire Marshal's office. We'll narrate those slides, and then we're going to pause, and I'm going to actually take questions and answers while the State Fire Marshal's office is on the call with us. Then Mr. Mike Como from the department today is going to talk about the physical education in grades 9 through 12 and provide you some guidance there. We'll have Ms. M. Cooper from the department sharing our virtual learning resources. We'll briefly touch on the vision and hearing screening process, our gifted and talented screenings, school staff safety best practices, and then we will again kind of review the regulatory waivers and flexibilities that are in place. And again, this slide here is one that we share every week. This is our slide of resource documents. I'm not going to spend a lot of time here today because we share these every week, but I just would strongly encourage you to look at two things on our website. One is the reopening guidance that we update often, and more importantly is our FAQ document. We are constantly updating this FAQ document in any time we get information from the field, such as an example with partitions, we add it here in the FAQ. So please go to our website and review the FAQ documents. Okay, at this time, as I just alluded to, we're going to introduce our special guests from the State Fire Marshal's office. So if you are on Mr. Browning or Mr. Joe Delano, at this time, I'll defer the floor to you and allow you to provide some words.
Yeah, thank you. This is Butch Browning. Thank y'all for giving us some time. Joe DeLawn is on the line. He's our chief architect. And I know he has some points to hit. We appreciate y'all taking time. This whole COVID mitigation started, I guess, in phase 1, and it has we're now moving into occupancies like schools, educational facilities. We've certainly learned a lot, and there's a lot more information and a lot more understanding out there than what was there, I guess, back in March and April. So I appreciate everybody's patience, and we've really formed a great team with all of the state and local agencies that's come together, and more just seem to come on every day, and of course working with the private businesses. So we look forward to finding a way to make it right with of course the public health, and then traditionally what we do in fire safety, in mind on the top of our list. So Joe, if you want to maybe give the overview of the things you've been working on, I think that's probably a good start.
Yeah, good afternoon. As Chief Browning said, we've been trying to work with everybody, trying to get everybody open, and these are certainly some unusual times. We've seen a lot of different inventive ways to mitigate these hazards, and this being one of them, the addition of these partitions. Normally, we look at schools to comply with the codes that are in place for safety, fire protection, means of egress, things like that, and we inspect them every year to make sure they're maintained. Desperate times call for desperate measures, and one of the recommendations was to subdivide some of the larger spaces. And it creates some challenges for us, particularly because normally throughout the course of a year, we have time to vet every individual installation and provide the recommendations based upon the specific application of it. In this case, we don't have that opportunity. We just got to get the schools open as soon as possible. So what we're doing is we've developed some guidelines. I know we had sent some brief technical guidelines before, just a couple of different paths to take. So what we've been doing is kind of to expand upon that a little bit, and hopefully zoom in on exactly what's I guess translated into English, for lack of a better term, so that you can choose the right products. Number one, the clear plastics, those are all very highly flammable. Anything that they add to those plastics to make it fire retardant will change the color. So anytime you see something that's clear, it's not a good option. The opaque colors are better choices. Some other materials that might be out there. And I know everything is always, cost is always a factor. So we're trying to find some low cost applications. The ones that I've seen are, fairly large tarps that are hanging from gyms and whatnot. I know there's a lot of different ideas out there in different applications. But each of those materials need to be fire retardant or flame retardant. And if you do have to have a clear divider, then that's normally a more expensive option. You're going to have to go to a vinyl or a plastic or a heavy a plexiglass type of material to provide that clarity in there. The other issues we're running across is for egress. We don't want to see any of these exits blocked. Normally when you take a room, the room is designed to where you can see the exit signs from any part. And when you're hanging these dividers in there, that kind of hides the path to the exits. So we want to make sure that we're hanging them in such a way that it's not blocking the exits or hiding the exit signs or anything like that. We're making a lot of concessions. Normally, a large auditorium or cafeteria, it's approved for a certain occupant load and a certain number of children, and it's based upon the arrangement of egress to where you can get out to whatever egress or whatever exit they can choose without being obstructed. So it's an additional challenge to be able to occupy a building in full capacity, no less. With these barricades in there. I know the goal right now is to limit the occupant loads, which is great. It makes it a lot easier for us to pallet and come up with a solution. In future phases, it may be a little bit more challenging. When you have additional occupants in there, we might have to remove some of those partitions to be able to allow for additional movement in there. A couple of other little things that we've been kind of looking at, or some applications are being hung from the ceilings. We don't want to get too close to the ceiling. If there's a sprinkler system in there, don't want to obstruct the water sprays, and also the smoke detectors. We don't want to obstruct the operation of the smoke detectors. So we put a little bit additional guidance about that in the memo that we're going to be hopefully releasing tonight or tomorrow. To kind of provide a little bit additional guidance in there. So other than that, it seems to be very simple, but when you look into it, it's always a challenge to find out exactly what the best way to do this or accomplish what we're trying to accomplish is. So.
Well, thank you, Paul. Do you have time to take a couple of questions? I've had a couple of questions come into the chat, and I told the group that we would normally we do our Q&A at the very end of today, but I know your time is valuable. So do you have time to answer a couple of questions that have come in?
Sure.
Sure. Can you speak a little bit more to what is coming in the forthcoming memo that is being released this evening, and does it address any type of waivers that might be considered at this time?
The concession that we're going to be waiving, so to speak, we really don't want to waive anything because everything we're doing is a minimum for safety. So we can't really waive safety. That's first and foremost. We've got to make sure that the children are safe. Bureaucracy, we can definitely cut through as much of that as possible. One of the concessions that we're making is instead of a full plan review, we're going to give you the guidance and trust you that you can be able to install these partitions in such a way that it won't create a safety hazard. We're also allowing the option, if you do have a plan, you can email it in and we'll look at it as soon as possible within a day or two, hopefully within, shorter than that. But we'll look at the plan, be glad to look at your plans that you have and the materials that you have and see if you're on the right track or not. I'll give you that address right now. It's sfmdispatch@gmail.com. And if anybody has any plans currently, you can send them there and we'll be glad to take a look at them.
Yeah, I'm going to put that, Paul, in the notes, just so I make sure everyone heard it. sfmdispatch@gmail.com.
That's correct.
Okay, thank you. We had another question came in. Are small mobile plexiglass, are you allowed to utilize those for individuals that may be teaching, say, for instance, a speech class? Could they have some sort of portable piece of plexiglass that rolls around that they could use when doing like speech therapy and speech sessions?
Yeah, plexiglass by nature is it's flame retardant. So plexiglass is really not an issue. The harder, thicker plastics are definitely better options. Our concern are the flexible sheetings that are being hung around. So the plexiglass is definitely an option.
Okay. And the other question that came in is in reference to considerations for hanging partitions. What are the kind of architectural guidelines around having a hanging partition, for instance, in a gymnasium or something?
Yeah, that's mainly what this memo is going to be focusing on. And what we would like to see is not blocking visual access to. I mean, you should be able to see an exit from any place that's being subdivided. We definitely don't want to be building corn mazes or any other kind of maze in there. You need to be able to access an exit and not create confusion by hanging these things.
And the last question we have that has come in is, do the plexiglass partitions for students' desks fall into the category for being flammable or non-flammable? Just some clarity on that.
Yeah, there again, the plexiglass is typically not an issue. They're made with a little different products, and they're harder and thicker, and they're not. I haven't run into any issues with plexiglass products at all, or PVC for that matter. A lot of these dividers are being created with PVC piping, as a structural support to hang these drapes on, and PVC by nature is also flame retardant. So, it's you can really tell by looking at the product if it's a clear, loose plastic, then it's the polyethylenes are really highly flammable, and that's the main concern.
Thank you. And last thing, where will they be able to find the memo that is being released tonight? Where will that be published or posted for public viewing?
Tonight or tomorrow morning, we're going to post it on our website, and also in Open Safely. Currently in Open Safely, we do have a category for K through 12, but right now we have not added anything to it since LDOE has been handling all that. So there's some very old guidance in there now, but if you do register, please wait till tomorrow morning to register there, and you can get it that way. We can obviously, we'll send you a copy, and you can blast it out if you have a contact list. Whatever other methods it would take to get it out there, we'll definitely we'll definitely have it available.
Right. Yeah. What we'll commit to doing, Paul, is we will put that on our we will put that in our FAQs on our website. So if you send that over to our team, then we'll embed that in our FAQs, which we update, and we'll probably have that updated tomorrow afternoon. So it'll be available for everyone here to view.
Yeah. I would imagine on our website would take a little bit more than tomorrow, or longer than tomorrow morning to get it posted up there. But hopefully by the end of the day tomorrow, we'll have it all readily accessible.
Okay. Well, that brings us to the end of our questions. I appreciate you, Mr. Delano, and our State Fire Marshal, Mr. Butch Browning, for joining us today. So again, it's greatly appreciated. Y'all are welcome to stay on board if you want and finish watching the Zoom session today. So again, thank you for joining us.
Well, thank you for the invitation. Well, stay safe.
Okay, Meredith, at this time, I'll turn it back over to you, and we can continue on with today's presentation.
All right. Thank you so much, Ken. As a reminder, we will be posting the slide deck to this webinar to our Strong Start library by hopefully this afternoon or this evening. So you will have access to these slides whenever you need them. So right now I'm going to turn it over to Mike with the Department of Education, and he is here to give us an update on physical education and the best practices and some guidance for carrying that out during these times. So Mike, the floor is all yours.
Thank you, Meredith. Good afternoon, everyone. I'm Michael Como, Healthy Communities Director at the Department of Education. We've had several questions come in about conducting face-to-face physical education in grades 9 through 12, but I think all of this guidance and the resources we have apply to grades K through 8 as well. Before I get into large rooms and separating groups, I would encourage physical education teachers to get outside as much as possible. I know it's very warm outside, but it's a good opportunity to practice social distancing and prevent further spread of the virus. But whether you're inside or outside with a group of 25 people, I would encourage you to divide your group into small cohort groups and prevent mixing those groups. Yes, you can have a large room divided like a gymnasium, but again, as you heard from the fire marshal, there will be some restrictions on partitions. Some of you may already have partitions or plan to add some, so make sure you follow that guidance. I think PE teachers have a unique opportunity because they have all of these other accessories like tape and poly spots and hula hoops. So you should use those to your advantage to keep students separated and practice social distancing and keep your cohort group separate. I'm sure you've taken a look at your physical education equipment and know what you have in inventory, and you should be deciding on what things or what equipment you can use that can be cleaned easily and effectively. There's not too many things I can think of that's too difficult to clean, but think about that and think about how you might clean that equipment in between classes, whether or not you're cleaning it, an assistant is cleaning it, or students are cleaning it. Again, designate certain equipment to certain cohort groups or grade levels so you can help keep it clean, especially those things that are frequently touched. You will have to modify the games, activities, and equipment that you use to prevent physical contact and that do not require students to be in close proximity to each other. So you may not be able to play those traditional games in physical education class, but it gives you a good opportunity, especially in the lower grades, to work on locomotor skills, and in the higher grades on some sports skills, and an opportunity to work on physical fitness as well. So I know PE teachers out there are creative. You know how to lesson plan around some of these restrictions, and I would encourage you to be as creative as possible and keep your students engaged in all activities. We do have some PE reentry guidelines on our website, and those will be things that you may have seen already or heard already, but they do include the physical environment, personal hygiene, equipment safety and sanitation, instructional strategies, and recess and physical activity. But the bottom line is, whatever you do, and you've heard it 1,000 times, is make sure everybody's wearing their mask, they're practicing social distancing, they're cleaning their hands as much as possible, and practicing good hygiene. That's all I have, Meredith. Thank you.
All right, thank you. As a reminder, if you have any questions for any of our guests today, or any questions surrounding reopenings, please put them in the chat and we will answer them at the end of this. So we're really grateful to our guests that have agreed to stay on to take your questions relative to the topics for today. So just make sure that you drop those in the chat for us. Up next, we are going to hear from M. Cooper with Academic Strategies to tell us about our recently released virtual instruction guide. So, M.
Thanks, Meredith. So this week we released 2 documents. The first one is the Louisiana Virtual Instruction Guide, and this is for school leaders and teachers, and it outlines expectations in 4 categories for what virtual instruction should look like in pre-K through 12. And those categories are high quality, standards aligned curriculum, interactive, engaging instruction, monitoring student progress, and student support. in this document, you'll notice that it feels very familiar. It is very closely aligned to the same high expectations we have for in-person instruction, but has been adapted to what high quality virtual instruction would look like. It includes links to some of our toolkit resources that we've released, but also to sample teacher and sample student schedules about what virtual instruction could look like. And again, just to reiterate, this is to help school leaders and teachers maintain the same high bar we have for instruction, regardless of it being virtual. It's also a really great resource that we've aligned in a parent version, and that's the second link that you'll see here. So the parent version of this document has a familiar feel to our other resources we provide parents. So it is question-based, and it is asking questions like what virtual learning will look like for my child, how will my child access virtual learning, how will their progress be monitored, how will my child be supported, and then how can I as a parent support my child during virtual learning. And so this is a 2-page document that is the parent companion for virtual instruction. And so we definitely recommend you check out both of these, and then for the parent guide, distribute that to your parents so that they have an understanding of what that will look like this year. And both of these documents were created based on the feedback we received from you all. So as you all were talking with parents or with teachers about this for the upcoming year, you wanted a resource that really just highlighted the fact that high quality instruction should be maintained and that students are going to receive that. And so I see many of you on the call who actually helped us create these documents. So appreciate your help here too. But if you have any questions, feel free to send those in the chat or you can email, and I'm happy to help as well. Thanks, Meredith.
All right, thanks, Em. We appreciate that. Last week, we had several questions surrounding gifted and talented screenings. So we went ahead and got with Stephanie Markham, who is in the Office of Career and College Readiness, and we have some updates for you surrounding gifted and talented screening. So Stephanie.
Good afternoon. This is Stephanie Markham. Thank you, Meredith. There's just a couple of updates around gifted and talented screening. So as a reminder, Act 688 requires that second and third graders receive a literacy screener, and that has not been waived, and that has to happen within the first 30 days of them reporting to school. So there is guidance for various learning environments, which specifically addresses how you can complete this screening virtually. It's in table 4 of that document. And any student that scores above grade level still should be considered for evaluation into a gifted program. We are still required to screen, test, identify students as gifted and or talented, and provide services for those students within the guidelines. So every effort should be made to continue to evaluate students for gifted and talented in person if that is an option, but we must meet currently the phase 2 guidelines, or we can also do it virtually. Services for students identified as gifted or talented need to continue within the guidelines set forth in phase 2 of reopening currently where we are. There is a set of guidelines that are linked here that are specific mostly to the talented resources. Gifted is an easier fix, but when it comes to the delivery of music and theater resources, there is guidance around that generally, which has been presented in these calls, but there's also a set of guidance that's been created specific to gifted and talented, which just reiterates some of that.
All right, thank you, Stephanie. And as a reminder for everyone, the guidelines that she's mentioning are found in our Strong Start library, and they are also linked on this webinar, which will be uploaded hopefully by this evening, if not tomorrow morning. So you will be able to have access to the newly created Gifted and Talented Screening Guidelines. So thank you for that update, Stephanie. And if anyone has any specific questions, please drop them in the chat and we will be happy to get to them at the end of this. All right, as another topic that has been brought to our attention if you listen to the superintendent roundtable for reopening last Friday, there was a very robust discussion surrounding school staff safety and how important it is and how vital it is that our school faculty and our staff also abide by the safety recommendations that we've put out for our students, because our staff and our faculty is going to be the piece that's going to help, that's going to keep our schools going throughout this tumultuous and unprecedented year. So we need to make sure that they're protected. So we came up with a series of best practice recommendations to add to your reopening or as you reopen your schools to keep in mind. When possible, faculty, PLC, administration, any site-based committee type meetings should be held virtual. If they are held in person, you need to make sure that social distancing, maximum group size, and facial covering guidelines must be followed. Additionally, administration and school systems should be reminding school staff, including our support staff, our custodial staff, our teachers, to not congregate in hallways, to not congregate in shared workspaces or other areas, to make sure that they are able to maintain their social distancing to protect themselves. Also, another recommendation that has been made is that teacher lounges, copy rooms, and other shared workspaces be closed or limited to 1 or 2 identified staff members to do those copy jobs or work in that shared workspace so that we can protect them. I'm sure that Dr. Finger has some thoughts on this that he would like to share with us, so I'm going to give him the opportunity to address some of this and maybe make some additional recommendations.
Yeah, thank you for the opportunity. I just want to echo this loudly because I think a lot of the out loud dialogue is focused on the classroom and the moving of students, but I really want to keep a focus on all the team members and making sure we focus on and remember how to keep them safe. And what we've seen around the country in areas where workers in any profession congregate and let their guard down are areas where there can be unanticipated transmission of disease. So I think helping to keep each other accountable is a really empowering thing that we can do for our team members, and that it's okay to say to someone, hey, remember, you need to put your mask on, or let's try and maintain that distance. I think empowering all team members to feel comfortable saying that to each other is really good. And then creating an environment where there's not 10 chairs in a very small room that's a teacher's lounge or an area where people can go as a break room. Just eliminating those is going to be really helpful to mitigate potential transmission of disease on school campuses. So I think I'm really glad to see this slide, and as leaders around the state sort of focus, make sure when you have an opportunity with all the team members that you spend a little bit of time focusing on this, and that it's not all dedicated just to the sort of face-to-face interactions with students, because this is an area where I don't want people to let their guard down. So thank you for bringing it up.
All right, thank you, Dr. Finger. As we reiterated, or to reiterate, we want to make sure we keep everybody safe this school year, and that definitely includes our faculty and our school staff. So thank you for those thoughts, and I'm glad that this has been brought to our attention. Once again, Dr. Finger is with the Children's Hospital of New Orleans, and they have offered a hotline that is staffed by their nurses that is available to school nurses and school administrators. We do have that number for you, and it is published on their website along with ours. They will also be hosting a town hall next Tuesday at 1 p.m., and it will specifically cover support staff and how to protect our students with disabilities who might not be able to maintain social distancing or wear the facial coverings. So they're going to provide us with some guidance and some tips on how to navigate those specific types of situation. So we're really grateful for their partnership. It has been an incredible opportunity for them to assist us as we go on to have a strong start for the school year. So the information is on this slide along with in the newsletter for this week, and it will be in next week's newsletter. They've also provided a school wellness page that is updated with printable school signage and parent resources. Hopefully by next week, they are working on getting a checklist for schools to share with parents, where it goes through the symptoms that parents need to look for as they go to send their children to school. So it will be something that schools can pass out and parents can put on their refrigerator to remind them to check their students for these symptoms prior to sending them to school. So thank you to Children's Hospital for meeting that need that our school systems expressed for us. We'd like to remind you of the regulatory flexibilities that have been issued so far for 2020, 2021. So just as the most updated and recent one was a camp waiver. The waiver of this statute allows for camps to be operated while school is in session. And this was waived with the intent to assist parents with childcare needs, maybe for older students as we are teaching in a hybrid environment or a virtual environment. So this was the most recent waiver issued by Governor Edwards. In addition, he has issued a waiver that temporarily suspends the physical activity requirement for K through 8 students. So that's something we've already discussed, and we just wanted to remind students that it is an option out there, or remind our school systems that it is an option. And then the transportation waiver, which suspends the requirement of using seniority of your bus drivers to bid on your routes. And these were passed with an effort to make transportation easier to navigate, as we are currently limited to only 50% maximum occupancy for our school buses. So if you have any questions, please make sure you drop them in the chat. If they are not answered today, you may email us at LDOE COVID-19support@la.gov. And those questions that you send to us help us define what we will be covering on our next office hours. And they also help us identify places where additional guidance needs to be issued. So we're very grateful for the questions that we receive to this email. So Ken, if there are any questions, I'm going to toss it to you. And I know we have Dr. Finger on the line, and he's going to be more than happy to answer anything related to medical issues that we might not be able to answer.
Yeah, I'll start, Meredith, with just a couple of updates before I turn a couple of questions over to Dr. Finger. And that is, I do want to just put a reminder about the vision and hearing, and that the department is continuing to work with the Office of Public Health. But the American Pediatric Association is recommending that the vision and hearing screenings continue, and the obligation for that is that vision and hearing screening be complete by the end of the first semester. What we are seeking clarity on, and we are reviewing, and we will provide an update next week and in the FAQs, is on the actual grade level requirements. It appears many districts are offering the vision and hearing screenings across multiple grade levels, but that actually may not be required by statute. So we will come back and we will be providing clarity around that. The second one that we are going to be providing clarity on is around the neck gaiters. Our current guidance actually does allow for those. There have been some recent studies this week that we have been made aware of, talking about, the effectiveness of wearing a neck gaiter. So we are having time with Dr. Welch and some of our other medical officials early next week, and we will get that guidance back back to you around the utilization of those. And just a reminder that, our guidelines are informed by the CDC guidance, and those inform the adopted standards. And when we have FAQs, we refer to those, but ultimately we defer to the Department of Health, and we're going to get that clarity for you in partnership with Dr. Welch. I'm going to next, I have a question for Dr. Finger, and that is, Dr. Finger, around the face coverings. And one is, are they required when students are out on recess? And number two, what type of quote unquote breaks, how should those be looked at from the perspective of a school teacher in a classroom? When is it appropriate, and how is it appropriate to give a break from the mask to students? And I'll pause and let you answer those, Dr. Finger.
Sure, thanks. And thanks for mentioning the Gator question. Actually, I've had some conversation with the regional medical directors, and we're all meeting next week with Dr. Welch. So all the regional medical directors and myself and Dr. Welch are getting together on a call next week to discuss these, so that we make sure that we are sending the same message in a uniform fashion across the state. I will tell you about the Gator question specifically, that at this time, there's not a recommendation not to use them, but I wouldn't be surprised if that doesn't come at some point. So I would say strongly recommend using masks at this time, but more to follow on that specifically after the conversation we have with Dr. Welch next week. The second question was about how to best affect breaks. I think when the kids are outside, my recommendation has been it's okay to be unmasked as long as you still focus on that distancing. We're going to bring that up to make sure all the regional medical directors are on board and sending that same message locally, because I think that's another place that folks on this phone call will be reaching out to for sort of that medical advice. So I do want to caution, I just want to make sure we're uniform, but I think that's a completely safe space in the outdoor area that they can be unmasked for a period of time. Same thing for taking mask breaks. I think it's going to be incredibly challenging for people to wear a mask. I know I can't do it for 12 hours a day when I'm on the hospital grounds. I think, in the classroom, when a teacher is up at the front and there is 100% certainty that there's going to be 6 feet of social distancing, they should be okay, at either class breaks or when people are leaving to take the mask off for a brief period of time. I don't think there's one right answer that says you can do it for X number of minutes. I think the biggest thing is making sure there's adequate social distancing when you have that mask off. I think that's the biggest thing. It can't be, even if I'm right next to someone, take the mask off for just a few minutes. It's if I'm going to take the mask off, can I ensure that I'm going to have adequate social distancing if I'm indoors? So that's sort of the two things that are linked. I'm not sure if that answers it specifically, Ken, but I do know that's one of the items that is on the agenda with the regional medical directors and Dr. Welch for next week.
Yes, thank you. Dr. Finger, also coming into the chat is another question, medical related, and just wondering if you can, next week also, we can have the discussion around the SMILE program. This is a dental program where there's student dental screening done. And so that if we can also have that discussion, and then what I think we can do is we can come back to this group here on our reopening call. And, I see 3 areas for updates: the vision and screening, the neck gaiter, and the dental screening.
Sounds good.
Great.
Yeah, I don't know about the dental screening, so that'd be great if we could come back to that.
The next one, Dr. Finger, is about asked, can schools do flu clinics at school for students?
If that's something that they have previously done, there's certainly not a contraindication to doing it just because of COVID-19. In fact, I think some pretty strong recommendations are going to come out in the next several weeks about making sure that our adherence to flu vaccination is better than it ever has been before. So I think anything that we can do on a local level to augment and amplify more people getting vaccinated for the flu when that vaccine is indeed available is great. So I certainly think that if that's something you've done before and have an ability to operationalize in the context of the current situation, that's a huge thumbs up. I had not heard anyone ask that before, but I certainly don't see why not.
Great. I've also received an update in the text chat that the Louisiana chapter of the American Academy of Pediatrics is working on a plan that they will be releasing relative to the mass vision and hearing. And so again, this is something that is in the works, and as soon as we get it, we'll put it in the FAQs, and then we will, if it's prior to next Thursday, we'll put those in the FAQs and then share it with everybody next Thursday. Next question, Dr. Finger, if you still have time, is about the libraries and best practices. Could you speak to students, should they be checking out books right now? Can they peruse the library for different books and resources? And I'll pause and let you speak to that.
Yes and yes. I can't tell you enough how much the library has sustained my own 3 children and myself over the summer, and I think we should not dissuade our children from being able to utilize that in the upcoming school year when they do return to in-person learning across the entire state. I know there's some anxiety about shared objects, but I think that the ability to have our children have access to books and stimulate their minds is far outweighed by the unknown and incredibly low risk of transmission of disease through that environment. I would encourage you that if we are allowing them to browse the library, that we have some ability to have oversight to ensure that physical distancing and masking remains intact in that space, because that might be an easy place for students to potentially be out of sight from teachers. I also don't think that that's going to cause a hot need for any additional heightened disinfection. I don't think there has to be someone who goes behind every child and wipes down each book that they touch. I do think if there's someone who is visibly ill with a snotty nose, hopefully that child would not be allowed in the library in that setting, and that would have already been picked up.
Thank you, Dr. Finger. Yeah, this is bringing us to closure on the series of questions. Do you have any other closing remarks, Dr. Finger?
Sorry.
No, I don't. And I just wonder, Ken and Meredith, if over the next couple of weeks we get information from schools that have started in-person learning across the state, if there's a way that they could give back to you guys, things that have really gone well or things that have caused an unknown speed bump. I think that's something we do here in the hospital. We share our safety stuff around the country. We don't protect it. It's open information because we figure that what's good for one group of kids and team members is good for everyone. So I wonder if there's an opportunity for you guys to foster that, if people can give things that have either gone really well as everyone tries to figure out a unique situation in their own environment.
Yeah, thanks, Dr. Finger. I'm glad you mentioned that. Every Friday morning, State Superintendent Brumley is hosting a superintendent roundtable, which is at 9:00 a.m. And it is superintendents coming together, sharing best practices, lessons learned, what's working, what isn't working, how they've overcome any obstacles or barriers to reopening safely. And so, yeah, would definitely encourage any school system leadership that would like to participate in those roundtables to join us on Friday mornings at 9:00 a.m. The information for that was actually in our newsletter this week that we sent out to school system superintendents on Tuesday. and is published
Yeah.
on our website.
Well, that's great. And I will tell you the one thing that I've learned sort of in these opening sort of 10 days as some school systems have returned to in-person learning is that there have been cases that have not been acquired on the school campus. And as schools work through that, I think what they have found is their setup, the environmental setup of how you have chairs set up in the classroom and how you monitor that really defines which students become close contacts. And being able to separate your kids a little bit is really helpful. We've had a couple of schools that have had 1 to 2 dozen kids be defined as close contacts because there was a gap in how things got operationalized. And I know it's challenging, but if it's done well and to a T, there probably doesn't need to be 1 to 2 dozen close contacts with every identified case on the campus. It's going to be hard and it's going to be a learning process, but don't be afraid to adjust and change things as you see things go live, because you'll learn things the first few days and the first few weeks that you weren't predicting, and it's okay to change things. That's all I've got, Ken, for this afternoon.
Great, thank you. Meredith, any closing remarks?
Just a reminder that this webinar and the slide deck will be posted to our Strong Start library. The FAQ will be updated to reflect any new information from this. And if there are any questions that were not answered, please feel free to email LDOE COVID-19 support@la.gov. So thank everybody for joining, and I hope you have a great and safe start to the school year. Ken, any last thoughts?
Nope, that's it for today. Thank you everybody for joining.